Good morning. This is Michelle Smith. Welcome to Advocating for School Health. I'm with Action for Healthy Kids, and we are excited to have you here with us this morning. Just real quickly, logistics. Obviously, you can use your phone, or if you're having trouble hearing, you can switch your computer or vice versa, whatever works if you're having issues with your audio. All attendees are muted, so you will need to use the chat function to ask questions. You can submit questions anytime. We will probably answer after each speaker and then have some time at the end, we hope, to answer any additional questions. We are recording the webinar and it will be posted to YouTube, and we will send you a link. So after the webinar is over, probably later this week, you'll get a link and you will also get a copy of the slides. So let's just get started. As I mentioned, I'm Michelle Smith. I'm the State Coordinator for Action for Healthy Kids. With me today are Joel Romo, who is the Vice President of Governmental Affairs for the Cooper Institute and Texana Public Affairs. And Joel's also the Chair of Partnership for Healthy Texas Legislative Committee. And then we have Tim Schauer, who is Principal with Cornerstone Government Affairs. And Tim serves on the Communication Committee with me, as well as the Legislative Committee for the partnership. So got some great resources here with us today, and we're excited to have them. Just a bit about Action for Healthy Kids. We've been around since 2002, working on issues related to obesity. When Dr. David Satcher said we had an obesity epidemic 20 years ago almost, they brought together individuals from each of our 50 states to talk about how we could best make an impact. And it was decided that schools were one of the best ways to really drive change. So we have been working since that time in Texas, and I've been involved with that, and have evolved over that time to focus not just on nutrition and physical activity, but the whole child, and the mental health and all of the different issues that impact our children's ability to learn and grow. You'll find a lot of great resources on our website. We have things that relate directly to the COVID issues, as well as other different things that would help you at your schools and at your districts around healthy fundraising, physical activity, recess. So visit the website. You'll also find links to different webinars. And then Action for Healthy Kids here in Texas also does a lot of different workshops, and you'll find those listed on the event pages, as well as we provide some grants for nutrition, physical activity projects across the state. So you can find out all about that on our website. So today we're talking about advocating for school health. Back in November, we had a summit, and we talked a little bit about the need to be engaged during this pandemic because children's health is critical. Even if we're doing remote learning, there are still issues that are impacting our children and their ability to continue to learn and grow. So the group that attended the summit wanted to know a bit more about how to better advocate. And so we have broken this into 3 sections, advocating for school health at the campus level, and then at the district level and at the state level. So I'm going to share some information around campus district participation, and then Joel and Tim are going to talk more about advocacy just in general, and then advocating at the state level. First, I'd like to talk a little bit about campus advisory committees. Every campus is required to have an advisory committee. It may be called something else. It could be a site-based committee. It could be a campus council. They go by different names, but it is the committee that functions at the campus level and makes decisions about things that impact the students. It involves buildings maintenance and things that are needed for improvements, grades, and how things are going there. So it was decided quite a few years back that there was a need to have some type of accountability around how kids were getting physical activity and how coordinated school health was being implemented. So those things were included in the Campus Advisory Committee report, and those reports go to the District Advisory Committee. So this is one of the things that you can get engaged with at your campus if you're a parent or staff. They may be a different composition. I know at the district where my kids went to school, they were 50% parents and 50% staff. Some districts have, maybe only 1 or 2 parent representatives. But that is one way that you can make change at your campus, is to attend or be engaged in this committee or bring issues up to that committee. This, as you can see here, this is just some of the things that they can make recommendations on. So first thing I would suggest is that you inquire about the Campus Wellness Committee. All the campuses can have a wellness committee as well as this Campus Advisory Committee. The Wellness Committee would focus more specifically on things that impact children's health. They would talk about recess, school meals, mental health concerns, bullying. So having a separate group that deals with those issues and then brings them to the advisory committee that is more focused on all the different elements of the campus is a good way to split things out and make it a little bit easier to work on school health. You can, as a parent, print up flyers and share those during drop-off and pickup time. We had a lot of good success when parents were, when we were in person, which right now we're not, but when children were being dropped off and picked up, parents would be waiting and you could, walk along and have conversations and share information with parents. Campus newsletters is also a great way to get information out there. And then having a survey to find out what parents are concerned about, because all campuses are different. There's going to be different issues in a middle school campus than there are in elementary school. And depending on the elementary school, one campus may be concerned about what kids are eating at lunch and bringing from home. Another one might be concerned about bullying issues, but you need to find out what is really concerning your parents. And then you'd have a better idea of how to get them motivated to get involved. With COVID the way it is, finding ways to reach out to parents electronically is another way that's got to be useful. Most of the schools that we've worked with have different programs they're using that reach out to the parents, and contacting your principal or your office person at the campus and finding out how you can send an information email out or through this, through whatever platform they're using is another way you can reach out to those parents. I would suggest that if you're, really wanting to make change happen, that you don't try to do it by yourself. Going into a principal as one parent will get your principal will listen, but they're going to be a lot more likely to make a change happen or work on an issue if you have more than one parent. So find a partner, find 2 partners to get things going on your campus. When you're talking about the district level, that's where the School Health Advisory Council comes in. These are mandated committees that function at the district level, and they are advisory committees that report to the board. They are required to have a parent as a chair or co-chair so that parents have a leadership position. They have to meet at least 4 times a year. Back when we first started working on school advisory councils or SHACs, some were reporting back that they weren't being very effective. So that they were only meeting once a year, and you really can't accomplish much if you're just meeting once a year. So it became part of the law that they would meet at least 4 times a year. So you have quarterly meetings of SHACs. They can ask the campus advisory committees to report what's in their yearly plans around coordinated school health and around keeping kids physically active. They can ask about coordinated school health programs. They were the group that was required to identify a coordinated school health program to be implemented at different districts. CATCH is one of those programs, so you may have heard that term, CATCH, which is a coordinated school health program that's used by, I think, probably over 60% of the districts. One of the other things you might want to inquire about is wellness policies. Every district is, if they have school meals that are a part of the National School Lunch Program or school meal program, they're required to have a wellness policy. And these policies are updated every 3 years. So this is something that the School Health Advisory Council should be involved with. Wellness policies are supposed to be developed, including parents and staff and child nutrition, different groups, and all these groups could be part of a SHAC. So finding out if your district wellness policies have been updated and looking at them can give you a better idea of what's going on around school health at your district. You should find copies of SHAC agendas and minutes on your district's website. Most districts post them fairly regularly. I've checked quite a few, or they would have copies that should be part of public, available to the public at your district offices. So those are things that you might want to look at if you're trying to get involved with school wellness at the district level. I mentioned SHACs. What is a SHAC? SHACs are the district advisory committee, which I want to emphasize, it's not a district advisory committee, it's a board advisory committee at the district level. So really, you're looking at this committee makes recommendations to the board. Normally you do it by cooperating with the district. So if you're looking at trying to develop a recess policy, you'd certainly want it to have the support of the district because it might not get implemented otherwise, even if it passes a policy. But it is the SHAC's purview to talk directly to the board and make recommendations to the board. Some of the things I think I've already mentioned, the chair, co-chair must be a parent, and the SHAC must include at least 50% of parents who aren't employed by the school district. Not that parents who do work for the school district aren't welcome, but trying to make sure that there are parents who are not concerned about what happens to their job if they speak out on a certain topic. So making sure that parents that not employed by the district are also part of that council. There should be at least 5 members, and they are to be appointed by the board. So here's where the board comes into play. This doesn't mean the board has to go out and find these members. Our SHAC used to have a group of SHAC members that were current members identifying new members, because SHACs have been around for a long time. If you don't have an active SHAC, then you might want to get with the district and let them help you identify, ask principals for potential parents who might participate. There's different ways you can recruit. And then I mentioned that they must meet 4 times a year, and you need to report to the board at least once a year, which is really great. Getting in front of the board brings school health up to that board on a regular basis. SHACs are also supposed to have a physical activity and fitness planning subcommittee, and they are supposed to look at how to keep kids physically active. Are there brain breaks happening? Is there recess happening? What other ways is there opportunity before or after school for kids to be active? So they can explore all those things and make recommendations to the district on how their campuses can keep kids more physically active. It could be something like monitoring the PE physical education programs and identifying how they're starting them off. Maybe the kids are coming in and sitting for the first 15 minutes waiting to get started, and they could be walking around the track or the gym while they're waiting to get started, as opposed to just sitting there. So there's different things that can be looked at and should be considered as that by this group. And then they can make those policy recommendations. There are other things that SHACs can and should be considering. Everything from type 2 diabetes, mental health concerns. They started out working specifically on human sexuality instruction. That's how they came into being, was working on that. But that is just a small part of what SHACs do now, because they look at all the different components of school health. Even looking at joint use agreements to make sure that the school and the community are working together. And if the school has physical activity areas, tennis courts, track, finding ways that the community can access those as well as the students. And then of course, daily recess is one of the things that's mandated by state policy, that School Health Advisory Council should be reviewing and making recommendations on recess. Right now, it's not mandated what they should do or if they should be requiring recess, but just that they should be reviewing best practices around recess and making a recommendation back to the district. They play a vital role in helping the community, and this is an important time right now for SHACs to be involved. So I want to make sure that all SHACs understand that even if they're not meeting, that there should be an opportunity for them to get engaged and look at different ways to support things, even if they're not meeting frequently. So looking at how SHAC can be involved is something that we wanted to talk a little bit about. One of the things that we've learned by talking to SHACs over the last few months is there's a lot of different unintended consequences or results that have happened because of COVID. There are definite concerns about physical education being eliminated when school reconvenes to make more time for academics, and parents need to be aware of that and make sure that their SHAC is engaged and involved enough to support physical education moving forward. School meal participation is another area of concern because it's challenging to deliver meals remotely. A lot of students are not getting meals, and I know our child nutrition departments are working very hard to reach as many students and families as possible, but it's very expensive to do this. And so it's put a financial strain on our child nutrition departments. So this is another area where your SHAC can play a role in trying to support those child nutrition departments and finding the best way to help them reach families and make sure that everybody has an opportunity for healthy meals. Another thing that has come out is my teachers that I've talked to have reported that they look at their little children on these Zoom platform or the different virtual platforms, and they can see that the kids are gaining weight because they're home and they're not being as active, and they may be eating more because food's more accessible for snacking. So trying to make sure that when we come back, these kids get the best opportunity they have to be physically active and try to work on some of the things that have impacted them while they've been gone. So there's going to be more focus on student health. Everyone is definitely concerned about our kids. And I think we need to make sure that moving forward, issues are addressed as much as possible. So what can your SHAC do? Over the summer, our organization brought in different school districts and different members of Action for Healthy Kids to talk about what the SHACs could do. And some of them weren't meeting, but there's no reason you can't meet. There are free platforms out there like Zoom, which is what we're on today. And you can use those to hold SHAC meetings. We've actually had SHACs tell us they've had more parents attend since they had the ability to use Zoom. Reach out to the district and ask how they can be supportive. There may be something the district needs that you have community members that can provide. We had one SHAC that helped get some of the community members together to make sure that all the kids had laptops. So a SHAC can really come into its own and be utilized if you can reach out to the district and join in. Issuing a statement from the SHAC that supports what your district's doing. Districts need to know that the work they're doing is appreciated and is meeting the needs. And you can also poll your members and find out what they may not be doing right and then report back. It's much easier to hear from a SHAC than it is from all the parents. It might have a bigger impact. And then using social media is another way to get information out there. We've also got a great list of resources. If your SHAC has a mailing list of parents and you want to send out resources on different things, we work with the Department of Ag and they let us know where school meals are available or where meals for families are available. So those type of things can be very helpful for your SHAC to get involved with. This is also why we think is a great opportunity to recruit more parents. As I mentioned, more parents are able to attend some of the SHAC meetings because they can come in virtually, whereas they might not have been able to attend in person. So use this opportunity to try to get more parents engaged, poll them to find out what their issues are, and then your SHAC can be looking at how they can best respond to those issues. It's also a good idea to look at your SHAC composition and make sure that you are representative of the different cultures in your community, in your school district, and make sure that you're supportive of all families. So SHAC can take the lead on a lot of different things if you get them involved. SHAC brings together people for school health, and as we've learned from this experience, you know, and my parents always said, or my mother always said, without your health, you don't have anything. So we need to continue to grow and learn from this experience. It's evolving, it's ever moving. Some of the things we talked about today won't be possible until we're back from remote learning, but there's a lot of things you can do remotely. So be sure that you're not letting your SHAC just say, oh, well, we can't do anything because we're remote. Use that SHAC to move forward. So do we have a question here? Okay, somebody mentioned that environmental health is an area that SHAC should also include. I agree. Should SHAC be reviewing and making recommendations for COVID district policies? Can district policies be more strict than state policies? Okay, multiple parts here. Yes, district policies can be more strict than state policies. That's one of the good things. And yes, your SHAC should be working with them. We've had SHACs that haven't convened, but their members have asked to be part of the reopening teams. So if you can reach out to the district and say, I would like to be part of the solution, I'd like to work on reopening, I think that would be a great opportunity. Joel, do you or Tim, do you have anything to comment on that?
I would say, yes, it's a good opportunity to, that's a great thing about the SHACs and local controls, and a good thing. They can be a little stronger and provide a little bit more guidance and set examples for our state leaders.
Okay, and said to Tim answered the question about, yes, these are state requirements that we're talking about today. Okay, well, I am going to turn this over to Tim, and he's going to share how to effectively advocate.
Hi, good morning, everyone, and thank you, Michelle, for including me in this. And the getting involved and being volunteering and stepping up on something like a school health advisory committee for some people can be really intimidating if they've never really been involved. They may see something that they want to work on. They may be passionate. You may be passionate about any one of these issues. Obviously, one of the questioners was passionate about COVID-19 and kind of things that are happening. But whether you've got a ton of experience in these or a little experience in these, I'm going to walk through a process that I hope simplifies the ideas for you so that as you get involved or as your SHAC is facing kind of new challenges with COVID and how the future looks right now and recovering from a pandemic and of course, addressing the overall issues of our physical and mental health of our children, particularly those that are, growing up and hitting high school and soon to be adults. What kind of health tools do they need to have to be productive, healthy, happy citizens in the state of Texas, right? And so I'm going to walk through a process here that I've used effectively with numerous community groups, most recently the Healthy Living Matters project here in Houston over the last 7 or 8 years. It's a community-based organization that includes our public health components and a whole lot of community activists from built environment people and school people and health people and all that, really talking about the epidemic of obesity in children in the Houston area. So Michelle, if we could jump forward. So what I want to talk about is the first thing to do is to try to simplify your thinking. A lot of times when people look at a really big problem, it's easy to get overwhelmed. You start thinking, and I'm just going to use childhood obesity as the example here. and you say, yeah, if you look at our school district and you get the data, or you ask the folks at the state to kind of show you what's going on or trend lines, you can become overwhelmed very quickly, and you'd be like, oh my gosh, we've got schools where 60% of our kids are overweight or obese, and where do we even start? And so one of the things that I like to advise people is using this policy cycle map, is kind of what I call it, because it allows you to bring together a whole lot of community voices. It brings together people from different walks of life and allows you to create some consensus, create vision and goal, and then keep you oriented as to what you're doing and why you're doing it. So let's start at the very top of our cycle here, where that first green arrow is, where we're going to talk about the issue or the problem articulation. Next slide, please. Well, actually, before we jump right into it, let me just talk about some principles of the policy cycle. I absolutely believe that good government, whether it be local government, state government, or federal government, is by, for, and of the people, which means it requires people to engage. You have to jump in. You have to talk with each other. You have to include people that may not agree with you. You have to include people who are in a different life situation than you. They may have 2 high school kids, and you may have an elementary school kid, and or more, or you may have somebody on the SHAC that doesn't have children at all, but they're a doctor in the community. So having inclusive dialogue within your community and bringing people at the beginning, not at the end, not when you're trying to convince them what your issues are, but at the beginning, trying to include people that wouldn't normally be involved, is to me one of the most important pieces that will make your overall process much more enjoyable and actually much more successful in the long run. You'll hear people talk about sounding off in a room of people that all agree, and everybody nods their heads and goes, oh yeah, this is great, and they try to move forward, and then they find out when they go out into the community that they're getting blown up because a lot of people are opposed to what they're saying, or that they didn't feel included. If you follow this policy cycle thing that I'm talking about, and you include voices from different organizations, from people that aren't normally involved, you will find that you can get a whole lot more accomplished early on, and you can get a whole lot more accomplished, and you can feel a lot better about the community involvement just through some really basic discipline things. One of the things that I recommend is that you set some deadlines on your process of what it is you want to do, and that you look forward and you say, okay, well, the school district starts in September. Here we are in January. We want our board to be able to adopt health guidelines for the coming school district, or for this coming school year. In order to do that, you got to talk to your school board. It may be the May board meeting that they adopt their budget and they adopt what goes on for the coming school district. So you may have to back up and say, well, when do we have to have our SHAC recommendations ready in order to do that? And you may not make it this year. You may have to say, you know what, we just don't have the time to get it for this year, but let's put the work in. Let's get the community involved. Let's go through this policy cycle thing so that we can get it, so we can get good recommendations and work on these over the coming years. And if we can, we'll try to get it in time for the school district board meeting. But if we don't, that's okay too. And then the other thing that I like to encourage is, a lot of people want to bring the CEOs and the big leaders and the board presidents and this and that into an organizational discussion. And that's okay. And you need to have some leaders involved. But oftentimes when leaders show up, they want to dominate or intimidate the participation of everyone. So be careful kind of about how you when you include people, that everyone at a SHAC has an equal opportunity to kind of share and talk about their ideas and talk about their observations about what's going on. Next slide, please. So step one, what do we do? Well, first of all, what's broken? What's not working? What do we all agree is the biggest important thing in our community, and not necessarily what does the research show of what the biggest problem is in Texas or in the United States, but if you're in, I'll use Pasadena, which is a community in the southeast side of Houston, and you take a look around and you say, well, what's going on? What health challenges do the students in Pasadena have? And you may even have a focus group or a discussion with people in your community just to say what's going wrong. What do our kids need? What's not happening for our kids? Or in using the childhood obesity problem, do we have schools that are significantly more obese than others? And why are those schools worse than others, right? And you haven't started to fix anything. You're just trying to articulate the problem and trying to draft it up into a statement of, here's what it is. We believe that childhood obesity is a problem in our school district, and that we have some schools that are significantly worse because they're not eating right and they're not exercising, whatever your pieces are. But you got to articulate the problem and make sure everyone around the room kind of goes, yeah, that is the number one problem in our community, and that's what we need to work on. You haven't talked about recommendations. You haven't talked about how. You haven't talked about what. All you're talking about is, do we have some consensus around what the problems are that we're going to fix? Because if you can get consensus around what problems are you going to fix, you're halfway to the solution. Believe it or not, you're halfway there. One of the things that I warn community groups is they want to rush forward and jump into a recommendation, and then they forget to make sure that everybody's on board with what the problem is. I'll actually use the issue of childhood obesity. In 2015. There was a group of people working on the childhood obesity problem. And then an article came out from the Northwest, somewhere up in Portland or Seattle or something, that childhood obesity was no longer a problem in their community. Well, it was a horribly written headline because it absolutely picked on one little community that had done some interventions and they'd worked, but it didn't mean anything about Texas. It didn't mean anything about their local school districts. So you really need to focus on and make sure that your community has identified and defined what it is you want to fix. Next. And then there's a thing that you'll hear people in public health talk about, a policy scan, right? What are the policies that are out there, and who wrote them up, and where are they, and why are they there? And it can be a useful tool, but it's only a step in the way of getting to the heart of the matter. The policy scan is much easier if you can get people articulating a problem, and then you say, okay, insecurity, food insecurity is one of the main problems that drives obesity. So what are the policies that create that we need to look at? And you haven't tried to fix anything yet. You're just trying to figure out the rules, just trying to figure out the policies that are in there that govern the issue that you care about. And so take a look at those things, but don't get so wrapped around the axle that you have to memorize all this stuff or you have to become an expert somehow at those policies. Stay focused, get people to agree. What is it we're going to fix? Next slide. So now you've got everybody on board, everybody around the table, or at least a consensus of the people around the table say, yeah, these are the issues we want to fix. And so you make sure you put those up on the board. These are the issues, 1, 2, 3. Don't pick more than 3 issues, because in any given year, trying to fix more than 3 issues gets you so watered down and exhausted that you'll burn out before anything. So focus on your 3 issues. What are the 3 things you want to fix? And then bring people to get together again and say, well, how do we fix these things? What is it we need to do? Are these things that the schools can fix? Are these things that we need to partner with the YMCA or a community group or something else? Do we need to talk to our county folks about putting in safe crosswalks so that kids can cross the street safely, or bike lanes, or whatever your issue is? Get it out there and get people creating ideas and throwing things out. And really kind of start small with what can individuals and families do, what can neighborhoods do, what can school districts do, what's going on, and throw those ideas on a piece of paper. Next. And then you get to start evaluating all these different ideas. Put them all down on the piece of paper, right? Figure out which ones are strong, which ones are great ideas. SWOT is strengths, weaknesses, opportunity, and threats, right? For those of you that have done strategic planning, that's not a new concept for you. But really figure out which recommendations have environmental factors. So for example, if you are in Southeast Houston, you got a problem because you're located right next to refineries. You're located right next to a whole lot of air pollutant things. Well, what is it that you may want to do related to that? And are there areas that you can collaboratively work with some of your corporate entities in that area? Your schools may need to have a conversation with some of those folks. What is it you can do? And put down what's the cost of it? What are the financing tools? What can we do to fix these things? And really spend some time fleshing those out. And then finally, when you flesh them all out and nobody's judged them yet, nobody's said this is good, this is bad, you just kind of put them all up there. Then you ask people to prioritize. And I found that if you ask a group of people to really prioritize what they think the most effective and efficient solutions / recommendations will be, and really build them up and focus them, you can get to a really good set of three, maybe 4 recommendations of things to do. And then you turn around and ask the community, these are the problems we found. These are the recommendations that your group, whether it be a school-based council or the SHAC that Michelle was talking about, these are the things that we want to do. And you may even take them up in draft form to the school board and say, hey, here are the ideas that we're working on. These are the problems. These are the things we want to fix. These are our recommendations. What do you think? You haven't started advocating for them yet. You haven't even adopted them. These are still recommendations that you're in discussion. Once you've prioritized them, once you've figured it out, then your group comes together a final time before you start pushing, and you get a confirmation. Do we have consensus? Are these the top 3 priorities? You get those things done, you look around the table and you're like, all right, now we're ready to go. Let's do something. Take the next step. And interestingly enough, this is where people tend to get a little bit freaked out. Next slide, please. And this is where you say, okay, how do we make this happen? And here's where people get, I put it in red there because this is where lobbying starts. When people start talking about, advocating, oh my gosh, I can't do that. I can't go and talk to a state representative or a state senator. Well, you may not have to. You may have to talk to the school board. You may have to just get in front of a couple of individual school members. And by the way, advocating in front of a big meeting is sometimes the most difficult and most intimidating. One of the least intimidating is picking up the phone and calling that person directly and saying, hey, do you have a few minutes? I'm on the school SHAC and I want to tell you about a project that we've been working on. Here are the priorities. Here are the recommendations. We'd like to get the school board on board and have a conversation with that person. Target them as the right decision makers. If you're looking to fix something that is related to a state law. So earlier somebody said, are these recommendations directly part of state law? If they're part of state law that you're going to be changing, you need to go talk to a state representative or a state senator. Again, if they are a county decision, if it's something that your county or your city can fix, is it something about roads in your area, bike lanes, parks? You got to figure out who in essence owns the issue, who owns the decisions that you want to change. And that's where you can really get focused and you say, okay, so I'll use the example that I know Michelle and I have worked on together and Joel and I have worked on together, which is recess. That in a lot of school districts, some of the boards have literally not discussed recess at all. They let it go all the way down to the principal. And then it turns out that some of the schools have either totally eliminated recess or minimized it so much in the name of improving testing that you got problems, right? So that one, you're not even going to go bother the legislators just yet. You may want to start with your school district and see if you can get your school district to embrace recess. We're working as a national or as a statewide organization on encouraging addressing recess policy, and it's going to be another issue coming up. But before you even go there, you may want to make sure that your school board is on board, right? And so be clear, have a simple message, go talk to them. Next. And this is also the fun part where you also figure out who cares about this issue. Obviously, the 6 of us around the table care, but it may be, you may find out that, a local clergyman or pastor, somebody from the YMCA, somebody from a nonprofit, some of the food organizations, you may find out, that if you put together a piece in your community newspaper, that you would end it with, if you care about this issue too, call me, call us. We're working on this issue. We care about this issue. We want to see healthy, happy kids at our schools, and we want them to be able to learn. And when they're not getting fed good food and when they're not having an opportunity to play, they're not learning, right? And so you're going to have to reach out and talk to some of the stakeholders. Believe it or not, sometimes the chambers of commerce in a community care about this stuff. And a lot of people are like, well, why would a chamber of commerce care? Well, companies move around and businesses move around to where there's a quality of life. And if the quality of life in your community is recognizably crappy, you may want to go talk to the Chamber of Commerce and say, hey, we want to improve the outlook and the health of our children and our families. And here's an idea. And you may find the chamber embraces that and wants to get involved. They may shrug and go, we do business issues. All we care about is, restaurant licensure. then move on, go find other groups. But build a parade. That's one of the ideas that I talk about when you're advocating for this, is don't try to go in and solve all the problems yourself. We have lots of tools, Facebook, Twitter, all these wonderful tools that we can network the heck out of it and find other people that want to join your parade, right? So most importantly, don't quit. You're going to run into people that are going to shake their head and go, no, I don't care about this issue. And that's okay. At least you know where they stand. Move on, go find some other groups that are interested. You're going to have to take some time. There are people that spend years dedicating their life to improving issues and improving school health, for example. I've got some friends who have been involved in school health for over 20 years. They care about it passionately. They've made a few, inroads. They've had a few good victories, but they don't quit. They keep on going. They love what they do, and they're passionate about making this state and our communities better every day, right? And then the big challenge is try to influence those decision makers to pass the policy change you want. So if it's at the school board, you're going to call them, you're going to influence them, you're going to say, hey, I'm going to be at the meeting, I'm going to watch you. I hope to have this on the agenda at the coming board meeting, and so we can adopt this and move it forward. This is important to me. I want you to do this. And that's this little piece, this one slide is one of the reasons a lot of people don't get involved in trying to improve their community. They're so intimidated by the idea of talking directly to a legislator or talking to a board member. But let me give you a little secret. They all put their pants on one leg at a time. They're no different than you and me. They just happen to have gotten into a position where they could run for office, or they have some idea that they think that their leadership quality, and they may very well be, but they are no different than you and me. Pick up the phone and call them, talk to them just like you would you or me. That is so important about what you're working on. You've spent the time, you thought about the problem, you brought people together, you came up with a good set of recommendations, follow through, pick up the phone, make it happen. And then the final slide, if I can, before I throw it over to Joel, is to me the next thing that's really important to make sure that you've done things is take a look at it. Let's say you recommended fixing something as it related to recess, right? And you found that you got the policy passed, and then you find out that schools aren't doing it. Well, why aren't they doing it? You have to evaluate, is the recommendation that we passed working? Is it giving us the results that we sought when we started this whole process? And if the answer is yes, great, keep fighting to protect it, to make sure it's sustainable, but also look at the next question. What next can we work on? Because that first time through was a lot of fun. We made something happen. But if you get through the first time and you haven't fixed the problem that you articulated when you started, then go again. Start again. Okay, we got 15% of the way to solving the problem, but we didn't get all the way. We only got 15%. Next bullet. And then you have to start looking and you evaluate. And every year, particularly if you've got a well-articulated set of problems and issues, have we improved over last year? And sometimes you may only get a 5% improvement, but you know what? 5% is better than going in the other direction. And I got to tell you, with childhood obesity, we've been talking about this for almost 30 years. I heard my first briefing on childhood obesity in 1992. And there were doctors saying that if these trends continue, and of course, back then it was all about we were watching too much TV, and there's no such thing as the internet yet, or at least not that anybody used. And so, but you got to pay attention to the data and the trend lines. And are we getting better? Or are we getting worse? And if we're getting better, great. If we're getting worse, you better make next year's cycle a little bit louder. And then the other thing that's really interesting is sometimes when people get involved, they do one thing, they say, yay, we won the battle, and then they walk away and they move on to some other issue and they do something else. And then 4 years, 5 years later, they find out that what they had worked on has completely been undone. And I'll use again, the back in the early 2000s, we worked with the Agriculture Commissioner, and there was a legislation regarding keeping food of minimal nutritional value out of our schools. And sure enough, 20 years later, that has been watered down so much that you see all sorts of stuff back in our schools, sugar-loaded candies and sweets and everything else. Now, we protected some of it. I haven't seen soda machines back yet. But in some ways, the cupcakes and all the other stuff that was pretty getting almost out of hand, some of it's coming back. So you have to look at what's going on. Can you sustain it? check back in, make sure that your committees are checking back in. And if you personally are moving on to something else, recruit somebody to take your position so that person can continue this, the efforts that you've done and keep on chugging along. Next. And then most importantly, if you have to, if it's just not working the direction you want, throw it out and start over at the top. Re-identify the problem. Are you working on the right problem? Maybe the problem you're working on that you think is the problem is actually a symptom of the problem, and you need to back up and figure out what the cause of the problem is. That's also one of the big things is I've heard people working on issues and they're convinced that if they just fix this one symptom, that things will get better. And then they do, and nothing gets better. And so they have to back up and start over the policy cycle. See if you can get to those root causes. What is it that causes the problem? So you've learned about the issues, you're acting on the issues, you're transforming your community one step at a time. So this is kind of exciting for me. This is what I work with a lot of community groups. I work with a lot of clients, whether they be corporate or nonprofit. This is a process that you can wrap your brain around, you can jump in, and you can keep things going. So let's see if there's any questions. There it is. There's the picture.
So there's one question, and I'll give it a quick answer and then let you guys as well. What do we do about policy not being enforced? So that's something at the district level and campus level. If you've got a school advisory council and they make a recess policy, if you don't have the buy-in from the principals, then the recess may not happen. So again, you've got to work with your district and with your school administration to make sure that it happens. And if it's not happening, that's where you have to activate your parents. And your parents need to come back and say, we know that recess is supposed to be happening every day for 30 minutes and we're not seeing it. Now, how do we fix this? And going to the School Health Advisory Council is, one of the ways that you can definitely approach it, or going to district personnel and say, excuse me, but my kids aren't getting recess. But
that's a great question on enforcement, because we've seen lots of great policy written in books that never gets implemented properly. And so my question to that is start going up that chain of command. Whose responsibility is it to enforce it? And what's the reasoning that they've got for not enforcing it? And in that one, you can do much better with questions and inquiries than jumping in. If people feel like you've attacked them, like you've jumped at them and said, you're not doing this right? They're going to jump right back and fight you and tell you 10 reasons why they're not. But if you walk in and you say, hey, are you aware that there's this policy related to recess or whatever the issue is? Can you explain to me why this isn't being implemented? And they may tell you, 2 or 3 reasons, and you may find out that it's because the principal was told by the superintendent that they better get their test scores up, and whatever they have to do, throw out all the other policies. By God, we're going to get the test scores up. And so then people start making really odd decisions because of the pressure that they're being put on. So then you almost have to jump over them and go, okay, I understand what you're doing. If I yell at you, I'm never going to get any satisfaction. Then you go up a little higher and you ask the person that has passed this, why is it that you're allowing schools not to follow policy? What's your idea? And they may say, well, my board's really coming down on me, because if we don't get these scores fixed, then, if we don't get these school scores up, we're going to be in big trouble. So then you all have to go to the board and you have to go like, guys, do you realize what you're doing is counterintuitive? You've put so much pressure on the scores that at the local level, implementation has caused some of the response, because of the type of pressure and the drive you're putting on, is actually causing your scores to go down, because kids aren't thinking, they're not getting recess. You've done a lot of bad things. They're not healthy. They're not eating good food. Let's slow down for a minute. And before you drive and absolutely beat up your principals and your teachers on scoring, let's look at the whole child. Let's talk about what is it that we can do as a community to help all of our children succeed. And so to me, you got to kind of figure, again, if it's not being enforced, who's not enforcing it and why are they not enforcing it, and see if you can engage in a conversation. Because again, nobody likes being attacked. If you go running in on somebody and you're like, you're not doing what you're supposed to be doing, then most people react with a very defensive posture of, well, I'll tell you what I'm supposed to be doing. And then you get into an argumentative position. If you can have a conversation, start it with questions, start it with a conversation, you have a much better chance of having a really positive outcome.
Thanks, Tim. Awesome presentation. We will have a little more time at the end if you have more questions. But right now I'd like to turn over to Joel, who's going to talk about the partnership and their legislative agenda and working at the Capitol. Joel.
Sure. Good morning, and thank you everybody for being here today. Everybody hear me okay? Michelle, give me a thumb there. Am I good? Okay. As Michelle mentioned, I'm here on behalf of the Partnership for Healthy Texas. I am the chair, and I think officially Tim is also co-chair. We're going to officially give him that title today. Of course, this coalition is chaired by David Lakey, former Commissioner of Health, and is made up of numerous public health organizations across the state of Texas. Next slide. A little bit of background. So this coalition came together in 2006. And we did this as a fact in a way to kind of partner and get more done at the Texas Capitol. What we were seeing is all our different groups were working not necessarily against each other, but it just wasn't coordinated. And we ended up seeing a lot of things, not get done. Had we coordinated and come together in terms of resources, research, and lobbying efforts, we would have got more done. So we put our coalition together. We brought in research. We've developed some great policies, Texas obesity portfolio. And during our first legislative session, we had 6 priorities, and 5 of those were passed. And now we are well recognized around the Capitol community from lawmakers and staff, and they value our input. They appreciate the one-stop shop with all our information and the fact that we come armed with sound public policies, data, we work diligently to pass these efforts. And so, we hope here today that you'll see some of the work we're doing in Texas and how you can work at the local level and utilizing our resources, but also being our eyes and ears. Next slide. Of course, as I stated, our mission is to develop and promote policies that prevent obesity in Texas. We've developed these guiding principles, which were with input from all our members. Encourage collaboration amongst all interested parties in reducing obesity. Our goal is to inform policymakers about the consequences of these diseases, promote evidence-based strategies at multiple levels, individual, family, and community. And we serve as a resource for individuals and entities interested in addressing obesity prevention. Next slide. This is just a sample of some of our members, everybody from the CATCH, American Cancer Society, Healthy Living Matters, Tapered, Action for Healthy Kids, on and on. Yeah, you can see for yourself. We've got quite a strong membership, and every one of these groups comes to the table armed with data, armed with resources, and works closely together to advance our mission. Next slide. So a little bit of background on what we've been able to do. And again, a lot of our folks work with folks like you back in their respective communities, or they hear from you. So we want to be a resource today and help you protect the SHACs, advance the SHACs, but also comprehend and utilize our resources as you work with your local decision makers, as well as we hope to engage you at our state level. But in terms of legislative accomplishments, in 2007, I believe that was a bill that passed. The last time we required the minimum minutes of physical activity in schools, and we established a physical fitness assessment to be done in grades 3 through 12, which is now known as FitnessGram. We worked at the Department of Agriculture to put nutrition policy, as what Tim mentioned. And by that, we had to not only work with the agency, and it wasn't a bill, but we had to work with rules, testify, and meet with staff. And there's a handful of us that were in those meetings regularly to make sure the agency would properly implemented those guidelines that came down from the federal level and adhered to those. We worked with lawmakers to expand and strengthen our school health advisory councils and allow all components to coordinate school health by adding accountability through the campus improvement plan. So we also have been active since the inception, was to secure funding for Department of State Health Services for evidence-based obesity prevention initiatives. And then we've been working at the Early Childhood Interagency Council to establish nutrition and physical activity in early child care settings. Next slide. And something I put together in the sense that never doubt a small group of thoughtful, committed citizens that can change the world and Indeed, it's the only thing that ever has. And this is where, the partnership started out small, and we worked with a lot of folks that were passionate about the issue. And since we continue to grow, but it's all about the small group of individuals that make a change and feed us information from the folks like you that feed us information and are not only our eyes and ears, but some of our biggest advocates in your respective areas, and help us get some lawmakers in your local areas, potentially some administrators that can help influence things. So we hope to kind of provide you that and help you help us and vice versa. Next slide. So Tim went over some of this. It's important that you engage with your decision makers, whether it be there at the school board, could be a city council in your local community, could be dealing with an issue, whether it be a sidewalk issue or some type of bike trail, etc., or your state lawmakers. Every one of you live in a legislative district. And I challenge you to, if you don't already know who your state rep is or your state senator, look that up. Go to the TLO website, Texas Legislature Online, and enter your address, and you can find out who your folks are. And we are happy to help you do meetings with them, and we'll get into that in a little bit. But it's important that you be part of those conversations now, and that you have your data and research, and that can be back up the policy you're working on. We have to dispel the myth that elected officials don't care what you say or what you provide them. They do. I'd say 90% of those in Texas legislature do care about what you say, the information you share, and the groups you're part of. And they're essential. You are essential to making turning votes. I've seen it happen with many of you on this panel that participated today. I've seen you walk the halls in the Capitol. I've also seen you know about you've been reaching out to lawmakers in the past. And lawmakers do, especially now in this environment, do pay attention to their social media channels and converse with constituents, and it does drive decisions on how they will cast a vote or what issues they will support. And of course, research and data are a very valuable resource, and they can turn a vote. And we'll share later how some of the resources that are out there. And of course, staying involved early and often. Many of you see these decision makers back home in the districts when they go home on the weekend or during the interim when you may go to church with them. You may have worked. They may have come toward your school, or you may know them just personally. As Tim said, they're just regular human beings. They most of them have additional day jobs. But so it's important that you engage not only with your lawmakers, but your school board members. Your school board members are critical, because eventually a lot of those, you'd be surprised how many of these school board members end up being state lawmakers. So engaging with them early is critical. And we applaud you that you're here today to learn more about some of the policies you help advance at the local and state level. Next slide. So here are our priorities. Just a little background. The partnership spends time putting together these priorities. We gather input from all of our members. We do a scoring system. We've done everything from locked everybody in a room for a day and done the little tabs and figured out, what priorities are top. We've done the Survey Monkey. We have conversations, and we come together with our legislative priorities in a thoughtful manner as well as strategic. And we did that this session, knowing that what the challenges lay ahead for us, whether we're going to have access to committee hearings or actually be in the Capitol. We also knew, as Michelle referenced in opening remarks, there's threats given the current impact of the pandemic. Many schools have not returned. There are threats that we could try to attempt to remove existing laws, whether it be PE or fitness assessments or nutrition guidelines. So we prioritize what we thought was most, what we needed to really be impactful, but also successful in as we advocate this legislative session, which just started last week. So next slide. As a result, here are the priorities that we came together, agreement on. We want to make sure all our Texas children have access to well-rounded education, which includes recess, PE, and instructions on health. So, we are pursuing legislation that would require school districts to create and institute recess policies that best reflect the practice and recommendations from SHACs, and that ensures our students are opportunity to have they have an opportunity to be active, practice life skills, and re-enter the classroom. We also are looking to increase middle school physical education requirements, include up to 6 semesters in middle school. High school PE minutes to be 3 semesters, which it was before. Now it's just one full year of PE, and make health education a requirement for graduation, which also was in place, but it was removed many years ago. And again, this was done with understanding now more than ever, we need to make sure our students are healthy. We need to make sure our, as students are healthier, there's less absenteeism, as you all know. They become better, they enter our workforce or the college setting healthier. And Tim said it great. Sometimes you wonder, why should we reach out, whether it be through the SHACs or locals and partner, or find out what your chambers of commerce are doing. I'll give you a good example. We doing some work in Oklahoma. One of the reasons that Tesla chose Austin, Texas over Tulsa, Oklahoma was because of their obesity rates. Oklahoma had higher obesity rates, less workforce percentage of employees that would be healthy entering the workforce, and Oklahoma and Austin was chosen in that sense. So you've got a major company looking at quality of life issues, and so if we don't start now, we will lose ground in that area. So that was our policies that I mentioned are in terms of recess, physical, and health education are stated, and we know we've got a lofty lift. But we have interest from lawmakers that are interested in seeing, a lot of them don't know what kind of PE minutes are required, or didn't realize that recess is not required. So we've got some work. We've been having some good visits, and we have some legislation being drafted, and we've got some individuals interested in filing those bills. Next slide, please. Food access. And again, this was has surfaced as an issue given the current pandemic, that many students that are not in schools are not receiving healthy food or food at all. We also have SNAP programs that were impacted. So we worked with our food partners in developing these priorities to, one, fully fund the surplus agricultural products grant, which ensures food banks have the produce to keep Texans from going hungry during the pandemic. We're also working with other partners and encouraging Medicaid managed care organizations, or MCOs, to implement initiatives to address social determinants of health, including healthy food access. And of course, increasing access to SNAP benefits for senior citizens by streamlining the application process. Many of these issues are being already worked through, whether it be the budget or larger pieces of legislation. But the partnership is working with all our partners and made these priorities, and many of these can trickle down to the local level as well. And we, can ask for your assistance in those areas. Next slide. We also are looking for a public health infrastructure to strengthen that. So we want to promote the efficacy of the whole child school health policy. Everything from school health advisory councils to physical fitness assessments, which play a critical role in our youth fitness and the physical education curriculum. We want to protect, as I mentioned earlier, and enhance current requirements to PE and health. And we want to protect vital public health funding at the Department of State Health Services to combat chronic diseases, including obesity. All these efforts are under, you could say, the threat. I mean, we have not seen a bill filed as of today that repeals any of these, but the time is still early. Lawmakers always are looking to remove mandates or to remove the burdens that they are hearing from school administrators. So that there is a concern, we feel this session, that given the current environment, more students are being schooled online. There is going to be a big push to have more local control and let schools decide how they do school health advisory councils, or if they have them or not. Removing fitness assessments, and not doing P. I think there was across the country, we saw, this is just a stat that we from the Cooper Institute, from March through the end of this past year, through the end of 2020, there was about a 47% decline in physical activity across the country. And so that was students that were not getting PE. There was a lot of sports not done. And so what we're going to see is a lot of obesity rates start increasing that we're going to see data on. Next slide. So along the lines of our policies that you saw that we've developed, we also developed some white papers. These are talking points with data on each of these subjects that we are using with lawmakers, that we are sharing with staff and lawmakers, that you can use at the local level as well as you meet with your school boards or your partners that you may want to engage as you look to maybe adapt some local recess policies or nutrition policies. These are all located on a Partnership for Healthy Texas website. We encourage you to take a look at those. We vetted them through our communications team. They're grounded in science, and we look for input or ideas on how else we can use this. We'll be rolling a lot of these out through our communication channels over the coming weeks. But we also wanted to make sure you saw these and have access to those. Next slide. Of course, as I mentioned, and we also did a state of obesity report. With all the partners, we were fortunate to have some resources to have a person that put this report together with input from all our partner organizations. And that is a phenomenal report that you could share with I would encourage you to use this report as an opportunity to meet with your school boards and share this state of obesity report and raise the issue of the need for more quality, whether it be at your local level, whether it be to make sure that whether it be a nutrition program or a healthy eating or whatever your policies that you're looking at adopting at the local level with your school boards, you can use this report to help you make your case. Again, it's well developed with partners from the Malcolm Susan Dell Foundation, the Pediatric Society, Medical Association, Action for Healthy Kids, et cetera. Again, everybody had a part in drafting this state of obesity report, and I highly recommend that you use it. We'll be doing a big rollout, I believe, in the next few weeks through the partnership. Next slide. Again, I want to thank you for joining us. We are happy to take this show on the road if when that day opens, if you need help at the local level. Many of us do travel, of course, right now with the legislative session and a lot of uncertainty. But I have, for one, have been able to, in the past, go work on policy issues at the Dallas School Board or some schools in Fort Bend County to help advance policies in the past in terms of sharing the resources we have and helping, as Tim said, shape that policy, engage stakeholders, massage it, and understand how a bill, whether it be a bill or a local policy, be implemented as well as enforced. Sometimes it just takes, again, that small, mighty group to be making the call and staying on top of issues and making sure people are being held accountable to get the end results. Because this is, at the end of the day, our most prized investment is our children. And if we don't have healthy children, we don't have a healthy workforce, we don't have a healthy military, we don't have a healthy law enforcement. And of course, the taxpayers end up paying a lot in terms of chronic disease costs. So I want to thank you for the opportunity to be here today. And I think we are going to leave this open for questions from the audience. So I'll turn it back over to Michelle.
Thanks, Joel. So appreciate you and Tim both. That's great advice and direction for advocating for policies. I'm looking for questions. If you have any questions, this is a great opportunity to ask these guys, or I'll be happy to weigh in on school health advisory councils. Martha says, we use the school health index to encourage all of the SHAC groups to review what we're doing. The T-SHAC evaluation sheet is very helpful. I do have a couple of slides that share some resources for SHACs, and you're absolutely right. The T-SHAC evaluation sheet is a great tool for your SHAC to determine whether or not they're meeting the expectations of what a SHAC should be. And then the school health index is a great tool to see how campuses are doing. We encourage all campuses to fill out a school health index to see where they are as relates to best policy around nutrition and recess and physical activity and different things. Do we have another question here? Are there any suggestions for preparing to meet with state representatives? Joel and Tim, you guys are the experts on that one.
Sure. You definitely, it's a good opportunity to introduce yourselves as a member of a school health advisory council and share with them that one, you are there, that they do have an active school health advisory council in their district, and that you want to meet with them. Right now might be a little bit of a challenge because of the session, but you can meet with their district folks or keep them informed. You can do virtual meeting. There's definitely tips on how to meet with them virtually and share with them, the concerns that the school health advisory council may have for policies that may be repealed, and to get them ahead of the game and have them be engaged early. So, we're happy to help prep you. And actually, I think we may have some tips. I'll have to look. If not, somewhere in our toolkits, I think we have how to do legislative meetings. Everything. And Tim kind of alluded to some of those. Everything from finding out who that person on their staff is that works on education issues or health issues. And you might meet with them. And if you meet with staff of your lawmakers, take advantage of it. Those staff spend more time right now with those lawmakers than lawmakers spend with their own families. So, them visiting with that office about the SHACs, many of them may not know what a school health advisory council is. It's a great time to educate them about it, share them the concerns, share what you've done, and offer to be a resource. So, hey, when Representative Smith is on the floor and there's a bill dealing with school health advisory councils, they can pick up the phone and call one of you, let's say, one of you that's on this training today, and they can call you directly and say, hey, I know you brought this up to me. There's a bill. Tell me if this bill did this or repeal this, how's that going to impact you guys? I've seen where lawmakers will do that. They will call people if they have met with them and kind of put out that warning flag of we want you to watch out for it. So I would definitely do it. It not only will help your work, but it'll help us.
Tim, I see you're going to type an answer there. You want to just share? One of our questions was, is there going to be a recess bill this session?
Yes, Summer, great to see you on the line. By the way, Summer is one of the wonderful people that started her own parade because she's passionate about recess, and there's a Facebook page that she created, and I follow that, and she posts up lots of good research on her issue. She's very passionate about recess and not only the physical, but the mental well-being that it helps children with. So Summer, thank you very much for being on the call. Yes, there will be a recess bill. We're working with some of the legislators. Anytime a bill's been vetoed, you have to explain kind of what happened and why. And so we're working through some of that stuff, but I anticipate we will have at least one, if not more, recess bills this session. So stay tuned on that. But one of the things I wanted to add to what Joel was talking about on how to prepare for a legislative meeting is I actually see a lot of people over prepare, and they get themselves so worked up and scared that they end up talking themselves out and they won't do the meeting. Again, state representatives are just people, folks. That's, by, for, and of the people. They are us. We are them. All you have to do is figure out, who are they? And my first advice to starting a legislative meeting is get to know them first. Do they even care about your issue? I ask them before I even start into my speech as to what I'm going to talk about. Say, hey, do you or a family member have a problem with obesity? I wouldn't say you, because that's pretty obvious. I might say, do you have a family member, or do you care about the issue of obesity? And you get them nodding. Yeah, I do care about that issue. And are you aware that in our schools, we've got a real obesity problem? So start the conversation by getting to know them and getting to know what their interests are. Don't worry so much about your prepared speech, because you can always give your elevator speech, your speech about your issue that you're passionate about. Most of you are probably pretty good about talking about the issue you're passionate about. But before you start talking, start listening a little bit. And this is good relationship advice, by the way, too. I wish somebody had told me this way back when I was younger, is that if you're listening to someone, they tend to think that you're a much nicer person than if you just start barking at them and start telling them how the world works. And so build a relationship. Just start asking them questions. Do they, have they ever had a loved one that's dealt with an eating disorder? Have you had an issue, with children that you've seen, in your community that aren't healthy? What are some of the health concerns that you have? Can make a connection. By the way, I do a really great program through Healthy Living Matters that we've done the last couple of sessions by bringing youth ambassadors in, and it's junior high and high school kids that come to the Capitol, and we have a breakfast, and I kind of train them about what they're going to do. And most of them are scared to death about going into the first legislative office. But we demystify the process, and usually by the end of the day, they're like, "Hey, can we go hit a few more legislative offices?" And so I get young people engaged in getting to know people and learning how to have that conversation. But one last thought I have is before you do a legislative meeting, try it out with your spouse or a friend or your neighbor, and see if you can get them convinced that the issue that you care about is important. And that if they were in the position of being a legislator, would they vote with you after they've heard it from you? Because sometimes practicing something with a friend of yours is a good opportunity to relax and to have that conversation. Because again, the best advocacy is when you make a connection with somebody who's empowered to vote on something, and those board members, the school board members, principals. I mean, how many of you have ever tried to go in and get something from a principal, and you start the conversation with, "I'm Johnny's mom, and by God, rah, rah, rah," and you just start barking at them? I highly doubt that's very effective. It's never been effective for me. But if you go in and you introduce yourself, you say who you are. Yes, you're Johnny's mom, and I just want to know what's going on here. I'm a little confused. Can you help explain things? You start it with a nice conversation, and the chances of you then having a productive meeting of all those issues that Joel was talking about and all those things that we're going to talk about goes up significantly higher because the person actually wants to talk to you. I'm always amazed at somehow Americans have been convinced that barking at each other is somehow going to change their positions. And it turns out that nobody changes their position when they're getting barked at. But when you have a nice conversation going and you start asking if other people care about the issues you care about, you might actually find some common ground. So that would be my first piece of advice is in prepping for these things, is try to figure out a way to get people to discuss the issue without you, and I use the term barking at them or lecturing them or whatever term you feel best about, but try to pull them into your issue. Try to pull them in and ask them if they care about their issue, if they know about your issue, the who, what, when, where, why of your issue, and see what they know. Find out if you've got common ground. I ran into a situation where the recess bill, for example, one of the far right legislators put our bill up as the dumb bill of the session or dumb bill of the week, and he made a mockery of it. And so most people would be like, "That guy's a jerk. I don't even want to talk to him." So I went in and talked to him. I was like, "Hey, why'd you put this up?" And ironically enough, the guy was easily 80 to 100 pounds overweight. And we tried to have a conversation. Now, did he come all the way around? No, but he stopped barking about the bill. He stopped being a jerk about it because I went in and had a conversation with him, and we tried to have a reasonable, rational conversation. So that to me is one of the most important parts of whoever you're going to be working with, whether it be the local principal, the school board, the legislators. Heck, you even use some of the same tools with congressmen. When you go up to Washington, D.C., or you meet your congressman in your community, you got to connect with them before they're going to connect with your idea.
I would echo that. And I'd say if anything you can find out about your legislator personally and his experiences, a lot of times what leads them in on different issues is a personal experience, just like your reason for being involved on some issues around school health. And I've seen a legislator turn on a dime if it relates to something that's important to them. If they've had a child or grandchild that is dyslexic, they are going to be more inclined to look at that issue and be willing to react to it. Or if you can personalize your issue to that legislator and make them understand why it's so important to you. You don't always have to have statistics and data. You can go in and see a legislator and say, "My child is overweight and not getting the physical activity they need. It's impacting their health, their ability to learn. We need to do something." And that legislator, if you're in their district, is going to listen to you. So it's like Tim said, you don't have to over prepare. You just have to be able to tell your story and make sure that you can have a meaningful impact on that legislator. I did notice somebody put in the link to the the Texas Legislature online. And if you're interested in seeing what bills are out there, you can go in. If you want to know who your legislator is, that link will take you in and you can type in your address and it'll tell you who your legislator is and give you a link to their contact information. You can also type in, if you're interested in recess, type in recess and it'll bring up any bills during this session that have been filed around recess. So there's different tools you can use to keep up with what's going on at the legislature, and we'll include some of that information in our follow-up email. We will send you the slides as well as a link to the video once we get it posted, and any resources. If Joel finds me that list of tips for talking to legislators, I'll include that as well. Does anybody else have any questions? I noted a comment, conversation is key and this advice is so important. I look forward to sharing this with our members. It seems so basic, so often goes unsaid. A lot of times it is. It's like Tim said, they put their pants on one leg at a time, and we just need to recognize that they're not that scary, and we can definitely all make a difference. Okay, just real quickly, these are included. There's the School Health Advisory Guide that was mentioned earlier, the laws from the Texas Education Agency, the rules actually that enforce the laws, local wellness policy requirements, different things here that will be useful to you. And then there's also some national information. There's a state school health policy database at NASB, which is really helpful. CDC has a lot of great tools on their website. And then there's a group called CSPI that has a lot of things that you might find useful around nutrition and physical activity. We do have some other webinars coming up. We have one on school meals on February 16th, and we have a two-part series in March on school health advisory councils, because we've still got a lot of requests for how do we get it going? What do we do to start? So we'll do, the first part is all about SHACs, and then the second part will be some of our more successful SHACs sharing their stories and giving you tips on how you can improve your SHAC. And then we also have on YouTube, if you will go to YouTube and check for healthy kids, healthy families, we have be almost 70 different webinars recorded on different topics that you can go and watch or share with your SHACs and find out more information. So I hope this has been helpful. If anybody doesn't have any more questions, I'm not seeing any more. We'll give you back a few minutes of your day, a whole 7. Thanks for joining us. We hope that you will take the opportunity to advocate at your campus, at your district, and with your state legislators. Joel and Tim, do you have any parting comments?
Thank you, everyone. And Michelle knows how to reach us. We work with Michelle all the time. She's wonderful. And the partnership is really about a statewide team effort, including, like Joel mentioned, providers and school people and everybody. And it's really a great group. So kind of stay tuned, follow in with what Michelle's got going. And thanks so much for being here.
Awesome.
Yep. Thank you for the opportunity to be here today, and look forward to hearing from y'all, and please stay engaged and let us know what you're hearing. And also, if you want to get involved, I'm sure we can find some ways for that to happen.
And you can join the Partnership for Healthy Texas if you want to keep up with the agenda that we have going there. So thanks, have a great week, and we'll see you on the next webinar.
Thanks, everyone.
Thanks, guys. You are much appreciated.
Enjoyed it. It was good. Take care.
All right. Take care, guys. Thank you.